y'all. I'm Dr. Perez. Welcome to The Breakdown. This is where I break down serious mental health issues into everyday language using examples we can all relate to. Today, I'll be discussing sleep. Typically, it's not a big deal if we toss and turn for a night or two, but for some people, restless nights are the norm. Studies show that more than 40 million Americans suffer from chronic or long-term sleep disorders, and about 20 million report occasional sleeping issues. Sleep disorders are characterized by abnormal sleep patterns that interfere with our physical, mental, and emotional functioning. We all know that sleep is essential to our health and well-being. Without it, daytime functioning can suffer, which may make it difficult for us to carry out our day-to-day tasks or to perform well at work. Lack of sleep can make completing complex tasks and tasks that require attention, thought, and concentration even more challenging. The irritability associated with sleep deprivation can cause problems in a person's social and home life, making relationships difficult. Insomnia is the clinical term for people who have trouble establishing or maintaining sleep. It can also cause you to wake up too early in the morning or wake up feeling exhausted. In children, insomnia may present as inability to fall asleep or return to sleep without parental intervention. The sleep difficulty occurs at least 3 nights a week and lasts for at least 3 months. It occurs despite adequate opportunity for sleep. Insomnia is diagnosed if the sleep issues are not better explained by and do not occur exclusively during the course of another sleep-wake disorder like narcolepsy or a breathing issue. We also want to make sure that your sleep issues are not the result of any medication or substance that you are taking. Stress and anxiety may cause sleeping problems or make existing problems worse. So which comes first, the anxiety or the sleep issues? It can actually go both ways. Anxiety causes sleeping problems, and sleep deprivation can cause anxiety issues. Research also shows that some form of sleep disruption is present in nearly all psychiatric disorders. So in addition to mood disorders, those people with long-term sleep issues are at risk for heart attack, stroke, as well as high blood pressure, diabetes, and obesity. The breakdown. Honey child, you can't sleep. You are like Lionel Richie, up all night long. You stare at the clock, toss and turn, and fret about all kinds of stuff that you can't do anything about at 2 a.m. If your nerves are bad, you really can't sleep. If your nerves are bad, they're gonna be. Another thing, when folks don't get enough sleep, they tend to be grouchy and impatient, like me when I need a candy bar. There is no single cause of insomnia disorder, but there are many factors that may contribute to the condition's onset. Insomnia usually develops in young adulthood and often occurs with another medical condition, whether it be medical or mental. The risk of inadequate sleep extends way past just feeling tired. Sleeplessness can lead to poor performance at work, school, increased risk of injury, and health problems. We all know that driving drunk is absurd, right? Well, driving when you are sleep deprived ain't no better. If you suspect you have a sleep disorder, please visit your primary care physician, a sleep disorders clinic, or a licensed mental health professional for proper diagnosis and treatment. Treatments may include psychotherapy, sleep medication, and relaxation techniques. Your doctor or therapist may recommend one or a combination of these treatments. Cognitive behavior therapy teaches you how to identify and modify behaviors that perpetuate your sleeping problems. Sleeping pills that treat insomnia are called hypnotics. Your Lunesta, your Sonata, your Ambien. Those are just examples of medications that might be prescribed to treat insomnia disorder. Not everything works for everybody, so please be an active participant in your treatment plan. Y'all know I don't care for benzos long term. But if you're dealing with regulating your sleep every now and then, I think they're okay. If you have true insomnia, you have to go a safer route. Even the safer alternatives have possible side effects. Make you do odd things like wake up and cook, or call your boss and tell her how you really feel about that Zoom call from this morning. To reduce anxiety and stress, there are several things that we can do in addition to those treatments I've already mentioned. One is meditating, breathing in and breathing out. Even visualizing our happy place. Physical exercise is a great outlet for frustrations, and it releases a mood-enhancing endorphins. Yoga can also be effective in reducing anxiety and stress. Regular exercise is going to help you sleep, but please limit your workouts to mornings and afternoons. Prioritize your to-do list. Spend your time and energy on tasks that are truly important, and break up the large projects into smaller, more manageable ones. Delegate when you can. Consider playing soft, calming music, which can lower your blood pressure and relax your mind and body. You want to make sure you're getting enough sleep. Sleep recharges your brain and improves your focus, concentration, and mood. The amount that you need depends on a lot of different things, including your age. In general, preschoolers need about 10 to 13 hours of sleep a day. School-age children require 9 to 11 hours. Teenagers may get away with 8 to 10 hours. Most adults need 7 to 9, but some people may need as few as 6 or as many as 10. Women in their first trimester of pregnancy often need several more hours of sleep than usual. Our older adults, those 65 and older, need 7 to 8 hours of sleep each day. Make getting a good night's rest a priority. Block out the time you need for a full night of uninterrupted sleep, and try to wake up around the same time every day, including weekends. Establish a regular, relaxing bedtime routine and avoid things like stimulants, coffee, chocolate, and nicotine before going to bed. And never watch television, use a computer, or pay bills before going to bed. Consider reading a book. Make sure that your bedroom is cool, dark, and quiet. Make sure that your mattress and pillows are comfortable. We're going to use our bedroom as a bedroom, not for watching television or doing work. And we're only going to get in bed when we're tired. If we don't fall asleep within the first 15 minutes, we'll get up, go into another room, and do something relaxing. Avoid looking at the clock. I know it's tough, but this just makes you even more anxious. Turn the clock away from you or wear an eye mask. If anxiety seems to be the root of your sleeping issue, seek guidance from a licensed healthcare provider to address those symptoms. If you've tried all of these things and you still have problems sleeping, you may need something a little extra. So, I hope you all have enjoyed this episode on sleep and anxiety. Please like, subscribe, and share. See y'all later.